Oh my
All
goodness.
right. So, good evening, everyone, and welcome to this very special edition of The Conversation. My guest, well, okay, so let me just give you a couple of disclaimers. So, it is
Oh,
my effort tonight not to talk to our guest as if he's family, because he is, because it's be a whole different conversation, and we just can't do that tonight. What we are going to focus on tonight is what has been happening, obviously, here in Mecklenburg County. We're going to talk about what's been happening back behind closed doors, as far as just the people power and the energy to be able to get behind all of this. What it's really been like to be on the front lines, literally on the front lines of battling this epidemic on all social levels. But then we're going to talk about the good news and what's going on here in the county, despite everything that we're having to deal with and the sacrifices that we have to make as a community. We're going to talk about the good things that we've both seen in terms of the community coming together to support each other and to help each other. So before we, of course, get into all of that good stuff, make sure, if you haven't done so already, like, follow, and subscribe at all things social media at The Conversation or at The Convo Pod Show. You can find us on Facebook, Twitter, Instagram, and of course on YouTube. We are now live tonight on our YouTube channel as well. So if you haven't subscribed, make sure that you go there. We're also live on the Conversation Facebook page. So I can see we both can see the questions and comments on Facebook, so feel free to jump in to say hello, to leave us any of your questions, and we'll be able to see them and hopefully address most of them, because we have a lot of ground to cover. So again, welcome to The Conversation, where we are going to talk about it. So needless to say, our lives have been changed in a dramatic way in the last 45 days. And what has happened as far as Mecklenburg County is concerned, and what has changed, and how things have ebbed and flowed, really go down to the people themselves, what people are dealing with, what people are experiencing in their own lives, and how their own livelihoods are affected. I'm so excited about my guest tonight, y'all. We tried to do this a couple of weeks ago, and it was just impossible. And not because we did not want to put this information out there. It's just that he wasn't getting any rest at
yeah.
all because of what was going on, and how Mecklenburg County and the state was dealing with all of the things that were coming at us at 150 miles an hour. So our guest is Anthony Trotman, who is the assistant county manager. So the technical title is, he is the assistant county manager. Let me make sure I say this right, because Consolidated Human Services Agency Director for Mecklenburg County Government. So in layman's terms, that means he's the assistant county manager for health and human services. So that's everything. That covers from birth certificates, to death certificates, everything in between, the health department, social services, even child support. All of that comes under the purview of what he manages. He manages over a $300 million annual budget, and has oversight for over 2,700 employees here in Mecklenburg County. And he is my cousin, one of them Trotmans.
All
You already know. So welcome to the show, Anthony Trotman. Hey.
right. I love
So
it. I love it.
how are you doing tonight? How are you feeling? Let's start there. How are you feeling?
Well, I feel good. I
Okay.
feel good because, one, this weekend was Easter,
Mm-hmm.
and I got some rest. We all took some time off. Although we were monitoring everything, we all took a couple of hours off just to celebrate the birth of Jesus. So I'm
Mm-hmm.
really happy to be in a community that believes
Right.
and celebrates. And so I feel good. I feel optimistic because I know we have some of the best minds working on this,
Mm-hmm.
both nationally and in our state and locally.
Mm-hmm.
So I feel good, and I feel good to be in a generous community. So I feel good about that. I mean, there's a lot that we're going to talk about, but I am optimistic.
Very good. So as you all join in, and okay, why are they tripping tonight? Now y'all already know that I have 2 cats, and they just trying to jump in my lap. It must be you, because they must know it's you, because they trying to say hello and everything. Anyway,
Yeah.
so tell us, so normally under a normal show circumstance, we would go a lot into your background and really tell your story in a way that is more comprehensive. Now, you actually came here from the county manager's office in Franklin County, Ohio. Is that right?
Yep.
So give us a little bit about your background in terms of how you ended up in government and city government in terms of a management role.
Well, I started in government about 20 years ago. I spent 10 years in the Air Force before all of that. And I was in Anchorage, Alaska, and Omaha, Nebraska. So anybody from those two places that sees me, it's a shout out to you all. I spent some time in Raleigh working in the healthcare industry. Then I went up to Ohio and was chief of staff of the state Ohio Department of Job and Family Services, which was a $19 billion organization at the time. Then I was the county director. Then I was recruited here about 5 years ago. So I've been in healthcare or human services for about 20 years now. No, it is 20 years. I started in 2000. So it's been good.
And so, and also a proud member, sir, of Omega Psi Phi Fraternity Incorporated.
Right.
Yes, sir. Yes, sir. Yes, sir. You're more than welcome to throw up a hook. It's fine. Yeah. Okay. Right.
All right.
Shout out to the brothers out there doing wonderful things in the community. So, so you ended up coming here to Charlotte. Now, was that a tough choice?
No. I mean, I really love the folks in Columbus. They're really good people, but being from the South, this was really just near and dear to my heart. I love Charlotte too. It's a beautiful place with a lot of beautiful people, and I feel at home. So I love it.
And so, okay, can we tell the story? We probably should. Yeah, let's tell the story. So you came here about 5 years ago.
Yeah.
And so about a year before you came here, you reached out to me on LinkedIn. Was it about a year? This is gonna sound so trifling, y'all. Just bear with me. Okay, so about a year before you came here, you reached out to me on LinkedIn. At the time, we didn't even know that we were family. And so apparently my trifling butt, which I never check LinkedIn. I check LinkedIn like 3 times a year, maybe. I just don't. Anyway, I didn't see the message at all. You thought, and correct me if I'm wrong, that I was just dissing you. Like, what was going on there?
No, I didn't think that at all. I had a friend that lived here at the time, and he said, "Man, I think you have a family member down here." And I was thinking about coming, and so I just reached out, and just there's a whole bunch of Trotmans in the world, so you never know who was reaching out. So I didn't think anything of it until I heard you talking, and the person was talking to you saying Trotman. I'm like, what? So then it went from there, and it's just been all love since then.
Oh, absolutely. No, but okay, we got to tell the whole story because that's only part of the story. So technically, so we were at, I'm gonna tell it. No, I have no problem telling it. So we were at the spot.
Yeah.
Shout out to Sports One, and it was quiet that night, and I don't even know who I was with. I promise I don't know. She and I were sitting at the bar, and no lie, y'all. He walked in. You know how you just kind of glance when somebody comes around the corner. So he walked in, and legit, as soon as I saw him, the very first thing I thought, I was like, dang, he remind me of a younger version of my daddy. And if you've seen any pictures of my father, like he's a Trotman, like for sure. And so I just didn't think anything else of it. He sits down there. Because it's quiet, I'm down there, cussing and carrying on, just being regular Yolanda, because I was still on the bench at the time. And so, so at some point he comes down, and what did you say? I don't know what you said. I just know I panicked. What did you say? Do you remember?
I just asked you your name. I said, is your name Yolanda Trotman?
Yes. And I said, I said, "Oh, snap." Because I panicked thinking,
Yeah.
okay, so I've been down here cussing. Gee, man, he's just like, this is not good. Cause I know I was loud because I didn't care. Cause that's a safe place for me. And so as soon as he said that, I was like, Jesus. But then as soon as you said your name, I was like, hey man, you family. Like we ain't have to go through like
Yeah.
anything other than like, oh, you family. Have you seen my daddy? You definitely are family. And then of course you told
I
me you
know.
had reached out on LinkedIn. And I was like, oh, my bad. And
Yeah.
it was just instant family
Yeah.
ever since. Has it been 5
Absolutely.
years?
It'll
Yeah.
be 5 years in September. Yeah.
Oh, that is awesome. Yeah. Yeah. And when I say family, family. So let me put this caveat out here before we get to the serious part of the conversation. So this is my because and while I may say, hey, y'all, this is cuz, or I may introduce him as because, not anyone on this planet is allowed to call him because other than me.
All right, little
Now that
cuz.
we've established that, okay, let's get to the good stuff. All right. And so let's talk about when you first found out. Because we know what the numbers are. We'll get to the numbers today because we know where we are as far as the curve is concerned. But tell me about the first time that you heard about this and how you felt like, or you were told that it was going to affect Charlotte. Like, how did you feel?
Well, I first heard about it when it was over in Wuhan, China, and
Mhm,
myself and the public health director, Gibby Harris, talked about this because we were getting these feeds,
mhm,
and said, "Well, we're monitoring it," and then it just continued to grow and grow and grow and grow. And matter of fact, we were before we had our first case. Myself and my boss, Dina Diorio, and several others were in Washington D.C. Talking about this situation with the CDC and the federal government, including President
mhm.
Trump was at this meeting. And
Right,
so we were looking to cancel the trip because we were nervous about being prepared.
right.
Then we came back early to really begin to plan and prepare. So it was like the first week of March
Mhm,
that we began to put the plan in place. And it just kept growing and growing and growing. As you know, from a national standpoint, how fast this thing grew and
mhm.
how fast it's grown, even in our community.
Right.
So it was around the first week of March when we began to plan. And then from there, it's just we've been working nonstop around the clock.
Okay. Now, literally, you mean around the clock. So how many days straight did you go, say 12, 14-hour plus days?
I don't know, 20, 25 days or so. We working Saturdays, Sundays. It's important for us to actually be committed. And I think the entire team that I'm working with is fully committed to this. And so it didn't matter. But, it got a little stressful at times because this is something that we've never dealt with before.
Mhm,
And all of the best plans that you have when you haven't dealt with something of this magnitude, it can get a bit stressful.
right.
But we're tackling one issue at a time and trying to make the best decisions for our community. And I think we're still trying. We're still learning, and we're still growing as a nation, as a world.
So
So
and so when you were first tracking it in China, did you feel like what did you think the best laid plans were at that point? And to be clear, for those of you who are watching, oh, your mama's watching. Your mama's watching. See you. Bye. Hey, sis. There's several other people who've joined. Hello to each of you. But your particular role as manager, you're managing the health department and you're managing social services and all of those other pieces that most of us are affected by. So when
yeah.
you're dealing with the director of the health department and your team itself, at what point do you feel like for you personally that it really hit close to home as to the magnitude? Because everybody can say pandemic, everybody can look at the numbers, everybody can look at data, but that doesn't put a human face onto it. So when did it become personal for you that we had to do everything and to move quickly as much as we could to be able to lessen the impact here in Charlotte?
Well, I would say when I was in DC the week before we executed our emergency plan, and I heard from the CDC, the leadership from the CDC, that said 80% of the country potentially would be impacted by COVID. And
Wow.
yeah, like most people potentially will be infected by this particular virus. And I had never heard a number like that. And obviously, from a data standpoint, everyone is kind of guessing. But then you begin to think about 80% of your own family.
Hmm.
And you have to make it personal for yourself, to then think about, okay, what do I need to do to protect my family and my friends and so on and so forth. So it got real, again, when I heard that, and it got really real when we began to talk about during the stay-at-home order, and all of the conversation behind the scenes before that was actually executed and communicated. It was real. So, and all the pushback on that too. So,
And was the pushback more economic, or what do you think? I mean, and obviously not going into details as far as conversations, but do you think the pushback was more of the economic impact, or perhaps in hindsight, maybe not understanding what the full totality of the impact was going to be on us if we didn't do that?
I definitely think for some it was the economic impact. I think for others it was, people felt like we were violating their civil rights,
Hmm.
to be able to do some of the things that they just love to do. They want to go to a restaurant, they want to go to the movies, they want to go to the gym, they want to do all those things that they normally have done. But all those things require, physical contact, and, don't really push the whole theme of social distancing that we're pushing. And we were very concerned about that because when we made some of those decisions, it was before there was community spread. But we
Hmm.
knew if we didn't do those things, the community spread would actually go a lot faster. And I think we've done some really good things in comparison to, New York and, some of the other communities that, acted too late. And the interesting thing is, we were supposed to be in New York City on March 13th. My
Oh,
daughter was,
wow.
she was running in the New Balance national track meet over that weekend.
Hmm.
March 13th was the day, it was her birthday. And she was excited about going to New York. And I was started to panic. Like, we can't go to New York.
Right.
We can't go. And I'm so happy that we made that decision, and New Balance made the decision for us ultimately because they canceled the meet.
Hmm.
But that was real when I wasn't going, but she was going. And I was really concerned because young kids were saying, this is about older people.
Right.
And and me as a young person, I can't be, it's not going to bother me. And that's not the case.
Mm.
So, yeah.
So there's a couple of topics I want to get to in a bit. For those of you who are just joining us, and I see a bunch of y'all. Hey, Harry. Gosh, quite a few people have joined. If you have questions, drop your questions in the comments because we'll be able to see them as we're going along. So let's talk about when you all made the first decision, when you made the decision to first do the stay-at-home order. Because I know for us, prior to that, they had just made the decision that courts were going to be down. And I believe that order, because the stay-at-home order came out when March, it was like the following week, the March, what I don't recall the date offhand.
Yeah. Yeah. I don't know, like the middle of March or so.
And I
Wow.
remember that the courts had closed, or at least the announcement had been made on the 13th of March, specifically because I was at the Family Dollar, looking for toilet paper. And I wasn't even trying to get toilet paper like everybody else. I just ain't had no toilet paper. Like it was before people were going buck booty wild over the toilet paper. But and I say that jokingly, but at the time I remember I mean, the rumor was already out that they were going to close courts, but I was like, okay, I get that, but I mean, we're only talking about a couple of weeks, and so it was 30 days. I know a lot of the attorneys were freaking out because we didn't know what that meant. None of us had ever been through anything like that, but it made sense from a health standpoint. I don't think a lot of us, me included, like we didn't get, well, does it need to be 30 days? Because we didn't understand, because we're still at that point at early March thinking it's not going to affect us. I mean, the memes are still circulating around. If you had ginger ale as a kid or you
Right,
drank
right.
out of a water hose, you good. Like, you're not gonna get this corona, or whatever was out there. Or even more frighteningly, so we're going to get to that if you were Black, it's probably not going to affect you, or if you're younger, it's not going to affect you, because at that point it wasn't affecting. There were no real cases, or at least in the media, it wasn't affecting small children, and you weren't seeing people on the news that looked like us that were being affected. And of course, that's changed dramatically since then, and we'll kind of talk about the racial disparities in just a second. But that being said, after Charlotte did its stay at home, I don't think people understood the magnitude of it then. What kind of pushback were you getting from everyday citizens? Did you find yourself having to explain yourself more often, or did you find the opposite?
Well, because we initiated the order, or initiated the state of emergency, the Emergency Operations Center manages the communication. So within the Emergency Operations Center, there's a joint information center made up of the city and the county and other representatives from the hospital. And they were getting bombarded with questions. And I personally was getting questions from many other nonprofits that we work with, and just, friends in the community. And most people were concerned generally about health. And then some folks were concerned about, the economic reality. And they were asking questions like, okay, well, am I exempt? Can we still do, these various things? And I don't want to call anybody out, but we were getting, lots of concerns that I should be exempt because I do this or that. And from the Emergency Operations Center, it was very clear that if we don't stand firm, we will allow everyone to continue to do those things, and we will really be behind from community spread. And even as I look at the parks, we got great pushback from the parks, and we want people to be outside. We want people to exercise and, get fresh air, but we want them to do it at a distance, other than, family members and whatnot. And from what we were seeing is people were not doing that,
Right.
which is why we went further, and we closed the gates so that people couldn't drive, to kind of limit, the activity. And, we may have to continue to go. Just depends on if people are adhering to it, because we want to keep people safe first and foremost.
And so I know even I remember seeing the article in the Charlotte Observer where they drove around to the various parks and people were out playing basketball and volleyball and all that. And then once that was closed, there was a second article that I saw where even though, you couldn't drive there, there was still a lot of traffic. Does that trouble you?
It does, because I think that people don't recognize who's asymptomatic. And they
Explain what
think
that means for somebody who doesn't know.
that means that I'm not showing symptoms, but I actually do have the virus.
Okay.
And thus, having the virus, I can infect somebody else without them even knowing it. I could be a carrier. And, as we look at kids and so on and so forth, many kids aren't showing the effects of it, but they could be carriers. And so,
say that again. Say that again, because I think people need to understand that, because you're not seeing that on television. You're not seeing any numbers that are affecting large amounts of kids, but I don't think people are understanding that even kids can still be asymptomatic.
absolutely, I think anybody can be asymptomatic, not just kids. But I would make the assumption that everybody has it.
Mhm.
Um, and thus, which is why we really are pushing the social distancing piece, because you just don't know. Earlier today, I saw a neighbor walk down the street, and that neighbor and he and his wife had COVID-19. And he was walking down the street with his two kids. And it really just hit home like, man, this person lives right across the street from me, has been infected. And, but he didn't look like it
Mhm.
um, beyond the 14 days and so on and so forth. But he did not he looked like just a regular person walking down the street. That's what COVID-19 looks like.
Mm.
It's not all about people being on ventilators and seeing the death count every day. It is also about those regular people.
Mhm.
And we are very concerned about folks adhering to our direction of social distancing.
And so, okay, so you see your neighbor walking down the street who has had COVID-19.
Yeah.
What did you do? Did you freak out? Did you say, "Hey, man, get your butt back in the house"? Like, what did you say?
Well, I saw him from the window. I wasn't outside. But understanding the time frame that it takes to get beyond it, and really making sure that you don't have a temperature for the 3 consecutive days. And we have a strong public health team that our communicable disease team will call these individuals like on a daily basis or every other day to make sure that they're getting the care and taking the care that they need to get beyond this. The big thing, 80% of the folks, get through this pretty well and they have mild symptoms.
And so let's get to I want to get to the testing because I know that's a big question that a lot of people have in Mecklenburg County, like how real are our numbers versus, our ability
Mhm.
to test versus who's hospitalized versus who recovers. So I'm going to want you to explain that and break that down for us in just a second. But obviously we understand now, if you didn't already know, what it means to be asymptomatic, but um, there's so much conflicting information out there in terms of what's a symptom. It used to be coughing and sneezing and tightness of the chest. Then it was, well, it could be just a fever. It could be fatigue. So as we've learned more about this virus, what would you say are the main symptoms that a person should be looking for with the information that we have now?
Well, one, we want everyone to stay at home, number one. Number two, if you feel like you're symptomatic, we want you to call your primary care provider. And if you do not have one, we want you to call the health department.
Okay.
And I'm going to make sure that you have all the phone numbers so you can post on your page
Okay.
and share with other folks so that they'll know which numbers to call. And so the primary symptoms that we look at when a healthcare provider screens a person is, do they have a fever? Do they have a cough? Is there a shortness of breath? And have they lost the taste and smell of food? If you have all four of those various symptoms, you definitely should call your healthcare provider or call the health department or call Atrium and Novant. And we're very lucky to have, two good health partners in our community that have, identified, certain issues, and they're going to be placing their mobile units in the east side and the west side of our community coming up this week.
Oh, that's excellent. Now, I'm gonna have you repeat again, what are the four things that they should be looking for? And then we're gonna circle back because I just want to make sure, because I'll post this later onto the page. But what are those four things again? You mentioned fever, loss of taste, and is it just taste?
Taste and smell.
Taste and smell.
Um,
Why is that? Because that's a fairly recent phenomenon. You weren't hearing about that initially as far as a symptom, or was that something that was known but just not publicized as much?
that was something that was known and just not publicized. As I talked about my neighbor earlier, they posted on their Facebook page all the symptoms that they were experiencing. And this was 3 or 4 weeks ago.
Hmm.
And one of them was loss of taste and smell. And this was the wife. The husband had it. He went overseas and came back and you know brought it home. And so he was quarantined in the house, and the wife was doing everything that she could do to socially distance from him. But it clearly was not enough. When he first came home, she potentially got infected that way. And so a few days later, she lost, um, the taste and smell of food. That was one of her first symptoms. You
Mhm.
hear.
I can't hear you. Did you lose us? Did we lose you on that end? Because I can't hear you, dear. Can you hear me?
So
Okay, go
you
back
all
for a
four
second since
symptoms
you hey,
are
cuz.
items that we look at.
Okay, can you hear me, cuz? Can you hear me? Can you hear me?
You
Can you hear me
there?
now? Yeah, I can hear you. I can hear you fine. You froze up on me for a little bit. Can you hear me now?
Okay. Yeah.
Okay, good.
I can hear you just.
Okay. Yeah, sit up a little bit because I think we lost it. Are you on Wi-Fi?
Yes.
Yeah, okay. All right, there we go.
I know. Yeah.
All right, good.
So,
Okay, so those are the four things that at least healthcare providers are looking for before they would actually do testing. Is that right?
yes.
Okay.
Yeah. They
And
will ask
so
you to call.
mhm.
Go ahead. I'm sorry.
No, go ahead.
I mean, they'll ask you to call, and I have some phone numbers I can say right now, but then again, I'll share those numbers with you.
Okay.
Um, for Atrium is 704-468-8888. And for Novant is 1-877-9 Novant or 1-877-966-8268. And for the public health department is 980-314-9400.
Okay.
And so
So
you share those.
all right, so health department is 980-314-9400.
That's correct.
Okay. Again, health department is 980-314-9400. Want you to start with your primary care provider if you have one. If not, then step 2 is to contact the health department. For Atrium, it's 704-468-8888. And for Novant, it's 1-877-9 Novant, Novant. Thank you for that. I'm going to post that as well. So you get through that and you have to go and get tested. Think we've all heard a lot as far as the testing is concerned. For those of you who are just joining us, make sure that you, if you have additional questions, definitely make sure that you drop your comments and your questions so we can answer them. Now, okay, assuming that you have to get tested, do we have mobile testing sites or drive up testing sites at this point?
We do, and Nova and Atrium are doing that. As I said earlier, they're going to utilize their mobile units, both of them, and they're going to be on the east side and the west side. And specifically, Novant is going to be at our health department at 2845 Bates Ford Road on the west side, and they're going to be on the east side at 5501 Executive Center Drive on the corner of Albemarle Road. And Atrium is going to be at their North Park parking lot, which is 251 Eastway Drive. And they're going to be on the west side at 1801 Oaklawn Avenue, which is First Baptist West. And so they're going to be screening and testing individuals at both of these locations. I would definitely call and or look at our website, mecnc.gov, and you'll be able to see when they're going to be out there.
So let me ask you this, because I want to make sure I got them correct. So the health department and Exec Center Drive, is that Atrium or is that Novant?
That's Novant.
Okay. And then Atrium is the Eastway Drive, North Park area, and at First Baptist West, which is on Oaklawn Street.
That's correct.
Okay. All right. So I'll post that and give that information out again in a second. Now, do you have to make an appointment and what are the hours?
For Atrium is 10 to 4 on Tuesday at their Eastway Drive. And at First Baptist West, it is 10 to 4 on Thursday, April 16th. I don't have the hours for Novant, but I believe they're going to begin on Wednesday, and I'll get you that information.
Is that both locations or the health department at this
At,
point?
at both locations.
Okay.
I'll make sure that you have all of that.
That's excellent. So let's just keep it real moment. So now what's going to happen and how do you think people are going to react? Because a lot of the numbers that we have, it's fair to say nationwide are based on the ability to test, right? Like are our numbers real based on the amount of people that we're actually testing on a regular basis with Atrium and Novant being now, oh, I'm sorry, before I ask that question, is this the rapid test or is this the test that's going to take several days or a couple of days for it to come back?
This is the test that it'll take about 1 to 2 days to come back.
Okay.
So obviously, since everything started, testing has definitely improved. And they will notify the patient or the resident of the outcome of that test.
Will they test you if you're asymptomatic or do you have to show symptoms?
After they screen you, they're going to make individual decisions on people. So I don't want to discourage anyone to say what they're not going to do.
Okay.
I think it's really up to that provider based off of the assessment that they do.
Okay. And so now that being said, let's move on to the racial disparities because it's kudos to Novant, kudos to Atrium for stepping up and going to the areas where it's needed the most, which is the east side and the west side. If we're going to be talking about what Charlotte looks like and dealing with the issue of racial disparities. Now, but nationally, obviously, we are looking at, and I talked about this with my last guest, Brandon Risher, last week when we were talking about sociopolitics. But I want to get your take on this because, you know, one of the big concerns that I have, and you working with larger metropolitan cities, just in the whole infrastructure of it all, is the issue what we're seeing in Chicago, where there's the huge disparity. Like 70% of the cases in Chicago are people of color. Like that's huge, especially in a larger metropolitan area. And that's not even with the level of testing that luckily cities like Charlotte are getting ready to have with their healthcare partners. Now, and then their issue has been the dramatic, I think the even more dramatic issue has been what's happening in their jail system. As of last week, I haven't checked the numbers today, but certainly last week they had 250 inmates who had tested positive and 150 officers or staff, which means those inmates, if they were just inmates there, they didn't get it. They had to get it from community spread from people coming into the facility. And of course, or people who are being arrested and coming into the facility. As of today, there's no known cases here in Mecklenburg County. We're very lucky. Sheriff McFadden has made sure everyone, including him, gets checked for fevers and all that, do a temperature check rather, before they're even allowed to begin their shift. And at least the 2 that were reported, according to the news, were caught before they actually began their shift. What's the big, before we get to on a micro level for Charlotte, when you look at bigger cities like Chicago, what is your concern here as it relates to Charlotte to manage it so that we don't have numbers that look like Chicago? And do you think that's more so an issue of people not being able to social distance that, you know, is perhaps affecting people who are the essential workers? Like, what do you think from a public health perspective are some of the reasons why Chicago is seeing what they're seeing?
Well, I mean, I think you're spot on about, you know, in some of these large cities where people aren't able to social distance like they do in smaller or medium cities. I think from a health disparities standpoint, we've known this before COVID, that African American, you know, and Latino communities had higher episodes of cardiovascular disease, hypertension, diabetes, poor eating habits, lack of access to fresh food and vegetables. We've known some of these things. And so as we look at, the data as far as who's dying, because I think that's, you have the cases and then you have the folks that are dying. Many of them, had multiple issues that contributed to their death. And that's unfortunate, which is why here in our public health department, we have been pushing with the faith community a program called Village Heartbeat, where we are decreasing, health disparities by promoting exercise, healthy eating. We've influenced the churches to take the fried chicken and the sweet tea, out of the basement of the church, and have baked chicken and green beans and water. And I think that is having an impact on some of those congregations, because at the end of the year, every year, we have an event where we celebrate the loss of weight, the loss of BMI. A lot of people don't have to take high blood pressure medication. Some people, have eliminated the need for diabetic medication because of exercise and the eating habit changes and just knowing your numbers. And I think in some of these cities, people, they don't know, or they may not have access to some of the same services that happen in other communities. And some of it, just to be frank, has been done by design. Our community has, really accepted the responsibility of what systematic racism has done to our community in segregating, poor people in parts of the community and everybody else in another part. We have accepted responsibility for that. And I think in some communities, they're starting and beginning to have those conversations and accepting responsibility there too. So it is not surprising, some of the disparate numbers, but we know that COVID is not a African American disease. It's not a white disease, Latino. It is not a rich disease. It's not a poor disease. It will attack anybody that gets in its way. So we have to respect it, which is why we push social distancing.
And so let's talk about a couple of the local community initiatives. Anetta chimed in and said, shout out to Cheryl Emanuel for Village Heartbeat. When did that program start? Hey, Anetta, how you doing, girl?
Yes, Cheryl is awesome. She has, we're an award-winning, actually, community county where we entered a national competition led by Cheryl and the team. And we won at all levels. And so from the Aetna Foundation, we received a $500,000 check to expand the work that we're doing with Village Heartbeat. And that's because of Cheryl and those pastors and the entire team. And Novant is one of our partners. They do all of the clinical services. So as for the entire team, we won and we are proud. But we have not won everything that we've set out to do because we still have health disparities. We're working with the corner stores to add fresh fruit and vegetables. We're starting farmers markets. We're doing a whole bunch of different things, but we still have issues that we have to deal with. And so we're not surprised by, the numbers, but we can't just accept it. We have to do something about it. And I respect the pastors and others that have challenged us to do more in the African American community and the Latino community. And we've had the county commissioners have requested that we do more. The county manager said we will do more. And so, we really are trying to tackle the issue. And that's one thing about our community. We don't really duck issues. We accept responsibility and we try to do something about it. But we have a long way to go to ensure that everyone has equal access to everything. And I know Anetta and CBI, that's one of their main focuses is equity and equality, as well as one of our focuses in the county too.
So I want to stay there for a second because you said it very eloquently when you were talking about race and systemic racism, and like none of this is new. The fact that the
Right.
media is now, this is the talking point of the media in terms of now seeing talking heads talking about the racial disparities, or why Black people, specifically Black and brown people, are dying at a higher rate for COVID. But let's keep it real. And you did, like, this is more than just underlying medical issues or medical conditions that are just affecting African Americans. This is systemic racism. This is disparities in the healthcare system in general that disproportionately affect us, and not having the ability or knowing how to speak up for their own health, or being put in situations where there's socioeconomic inequality. It depends on which hospital you can get to. Which hospital you can get to should not depend on the level of care and concern and attention that you get. But in reality, that's what you're seeing in a lot of larger cities. And I think, one thing that Brandon said on the show last week that I thought it was very true and compelling, and I don't know if you would agree with this or not, but, historically, doctors will look at a Black patient versus a white patient with the same or similar issues or diseases and think that that Black person can get past it, or they're stronger, or they can take the pain more, or they can take medication
Mhm.
less to be able to address those issues because of their biological makeup, and may be dismissive of symptoms because of the ability to go through it, or will send them home for the emergency room faster versus admitting them to actually monitor them, so that
Mhm.
this doesn't become an issue. So I don't know what your thoughts are on that, but you did bring up the fact that race is an issue in the healthcare system, and that we have to really wrap our arms around it and not talk about it just for a media cycle, because that's what we're doing. We're talking about it for a media cycle. I'm pretty sure this is not going to be the forefront of the conversation in a couple weeks, and I'm sad to say that, but I don't think that's going to necessarily be the case. But what do you think?
Well, I hope that the conversation picks up steam. I mean, again, one of the goals of this board, our board of commissioners had four priorities, and one of them was equity and inclusion. And they lifted up race and racism as one of the main issues in our community, and we created an equity and inclusion position within the county, two positions to actually lead that effort. CBI has been working on that for years. The city has been working on that. And now the entire community needs to work on that. One of the issues that we have is we don't have enough access to charity care. CW Williams is, been here for a long time, and they're doing some really good work. But we only have one CW Williams. We have two other free clinics, and they're called Federal Qualified Health Centers. And for a community of our size, we need about 10 to 12 of them, and not just three. We need to provide better access to healthcare in our community. I know that's a discussion nationally and on the state level, but it is an issue when you're not getting the level of attention that you need, especially as we talk about Black folks starting on the 1 yard line and everyone else started on the 50-yard line.
Mm.
We have to put more effort and attention and funding in the community. And that's one of the things I talked about earlier that I'm proud of. I'm proud that we have a diverse community that recognizes it. We just have to execute on it. We got to get it done. And I don't know, COVID-19 will never go away. We won't see it in a cure, but it won't go away. This conversation doesn't need to go away neither.
And so when you're talking about, and when the county is talking about the racial disparities and some of the things, one of the things that you mentioned was some of the smaller corner stores adding fresh food, to the extent that they can, to be able to eliminate or at least start to deal with the issue of food deserts, because that's a problem nationwide in terms of being able to get access to healthy food options that are reasonable in areas
Mhm.
that are underserved. So other than that, are there any other plans that the county has to be able to address that? Because, food is life. We know that.
Right,
And,
right.
addresses issues, can help issues, um, and can help avoid health issues. So what are some of the things that the county is considering beyond that to address the issue of food deserts?
Well, it's interesting you bring that up. The commissioners challenged us. They challenged the manager and myself and others to, develop a plan to add, various grocery stores on the west side and eventually in the east side and other places. Because if you look at the west side, there's limited access to grocery stores, and you have the one on the Walmart on Wilkerson, I believe. But I mean, that's it. And
Mhm,
so, as we were beginning to have conversations about it, COVID hit us,
mhm,
and it changed um, everything about what we were working on a day-to-day basis. And we're going to have to get back to it. But because the challenge has not ended, Commissioner Leak was, led the charge, and all the commissioners supported the charge that she led for the manager to come back with a plan. It's just all of our effort and attention went to COVID,
mhm.
and thank God it did. But we're going to get back to the point to figure it out. And we've been studying other communities. We've looked at a few proposals. The issue is government does not run private business, and the grocery stores are private businesses, and they want to make a profit. And so the question is, what role does government play with business? And that's been a challenge for us. That's been part of our conversation. We haven't totally figured it out yet, but the challenge has not ended by the commissioners and or the manager. So we're going to figure this out because we know that just working with corner stores and doing farmers markets is not enough.
Absolutely. Okay, you're gonna enjoy this because I don't know if you can see it on your end. Dr. Rigsby said, "Let the record show that you all are doing an amazing job, and that you
All
truly
right.
care for your employees." Shout out to Dina Diorio, the county manager, as far as leading the charge. Trinavia, thank you for posting. She posted the study that you were referencing. It's actually in the comments
Okay.
as well, so we'll be able to share that at the end. Okay, so I'm gonna go back real quick before we go and tackle a couple issues with small businesses and some of the good news, because we need to get to the good news.
Oh,
If you're just joining,
good.
great news. And I don't even know if I didn't see this on the news tonight, but this is fantastic news that there are mobile units that are going to be put in place by both Novant and Atrium. Testing is free, and it will be at the following locations, and I will post this in the comments, and I'll post it to all three pages and on the YouTube comments. But Novant will be on the west side at the health department. If you don't know where that's located, that's 2845 Beatties Ford Road. They will also be at 5501 Executive Center Drive. That's the corner of Albemarle Road and Executive Center Drive on the east side. Tentatively Wednesday, but we're not sure about that. You're going to get back to us and let us know when that is and the times. Atrium will be at North Park, which is at 251 Eastway Drive on Tuesday, tomorrow, from 10 a.m. to 4 p.m. And on Thursday, there will be at 1801 Oak Lawn Avenue. That's at First Baptist West on Thursday. That's this Thursday from 10 a.m. to 4 p.m. And it's like you said earlier, certainly not discouraging people from coming if they're not outwardly showing symptoms or if they're asymptomatic, because they will go through their screening process. And again, if you do not have a primary care physician, you can always contact the health department if you are experiencing symptoms. So don't let the fact that you may not have health insurance deter you, or if you or someone you know is having symptoms of COVID. I can't stress that enough, because oftentimes and sometimes in our communities, you think you can just, oh, it'll be okay, or it's just a cough, or it's just a fever, or it's something else. And it really could be something that's more serious. But on the flip side, don't freak out. You cough and you like, now I got the Rona. It don't we don't want you to go to the other extreme either. I ain't gonna lie, I did that last week, cuz I was like, sorry, I was like, oh my God. I got a hot blast. I hope it's not the Rona. Anyway, seriousness, like please, please, please take advantage of these, because Charlotte is very lucky to have two major healthcare providers in the same city who are really stepping up. And I think and we know what's going to happen, the numbers are going to change. So what we have to also be realistic is when those numbers change in Mecklenburg County and you see the numbers tick up because we're testing more people, that should hopefully not just, we don't want people to panic. I would think that would be your message. Don't panic, but also be vigilant about wearing your mask and social distancing, and making sure you put yourself in a position where you're not exposing yourself to unnecessary risk.
Right. That's a really good point.
Is there anything that you wanted to add on as far as that it goes, as far as the mobile testing?
No, I think you've summarized it very well. So,
while we're on that topic for just a second, now obviously Mecklenburg County leads the number of cases, but what we're seeing in all counties is, what are we doing to address the numbers that we're seeing, these explosions in nursing homes and rehabilitative centers? How are we addressing that in Charlotte, so we're not like some of these counties where they're seeing 30, 40, 50 cases in a cluster in a nursing home or rehabilitation facility? How are we addressing that here in Mecklenburg County?
Yeah, when we first started to plan, we identified the nursing homes as one of our primary partners, as well as our child care providers, our school providers, as well as obviously healthcare, and our shelter providers. Any place that there's more congregate settings. And we educated them early on to really implement social distancing within those nursing homes and limit the amount of interaction that they had with the general public going in and out of those facilities. And I believe that they did that. I'm not, totally 100% sure of everything that they're doing, but they were educated before we had the first case on what to do. In our public health department, which inspects them, one of the areas in public health is environmental health. And that's one of the areas that we inspect, along with restaurants and child care providers, et cetera. So we've educated them early on what to do. And so, you haven't really seen large spikes there, because I believe they know what to do and they know who to contact. But you never know. You just never know.
And so what about with our homeless neighbors, as far as how are we addressing that? Because I don't need to tell you, and hopefully anybody watching, that obviously we have a major issue in affordable housing, and just in general, but more specifically in the age of COVID. How are we helping our neighbors who don't have homes to keep this from spreading? And then, of course, being a hot spot at the men's shelter, the domestic violence shelter, and some of those other places. How are we addressing those issues within the county itself?
Well, we have leased 5 hotels to address those issues. 2 of the hotels are for social distancing of the homeless shelters. And so when we initially reached out to all of our shelter providers, we asked them what they needed. And because our shelters are somewhat crowded, they said they needed to provide social distancing and remove some of those folks out of the shelters. Okay. So they told us how many hotel rooms they needed, and then we went out and found hotels and leased those hotels. We also leased 2 additional hotels for isolation and quarantining. And so if a person doesn't have a place to go, but they need to be quarantined for 14 days, or if they're positive and they need to be isolated for 14 days, we have 2 hotels to place those individuals in. We also have a hotel for first responders.
Oh,
Um,
wow.
yeah,
Now,
if
why
they,
isn't this information get okay? I'm sorry. I mean, come on now. This is absolutely information that people do not know. But I'm sorry. Go ahead. Go ahead.
well, I mean, we're not advertising those locations because we don't want the media or anyone to go there and make it a bigger issue than what the individuals already are dealing with.
Right.
So, but we've done a lot, and we're doing more. We went out and purchased porta johns and hand washing stations for those folks that are still homeless. We've worked with the hotels and motels, working with our court system. They've issued an order for no evictions of hotels or motels because some people live at a motel or hotel.
Mm-hmm.
That's their primary residence. And so we worked initially with Crisis Assistance Ministry to contact anyone that potentially could be evicted. We worked with legal aid to ensure that all those individuals knew their rights. So we've done quite a bit. The city is meeting tonight, and I know that they're going to be voting on a package to help, some more medically fragile individuals to be housed as well. But your point when you started was we have an affordable housing issue here. We do. Beyond this crisis, we still will have a shortage of affordable housing. And so I know that we've been talking about it for some time, and we're building and rehabbing and all those good things to keep people in place. But we need to do more, and we continue to have those conversations with our city partners and the Foundation of the Carolinas, who raised over $50 million to build affordable housing units. So,
Excellent.
yeah, yeah.
So what about now I don't know if this is within your purview or not, but perhaps there's information that we can get out there. Are we going to what's the status of public transportation as far as light rail and buses? Is there an increase of free options? Or what's the status of that? Or if you can speak to that.
It's free.
Okay.
That's the status.
Light rail too, or just the buses?
Yeah. Light rail and buses. The city stepped up along with our cats and made a decision because for the most part, if you are not staying at home, we expect you to be going to your doctor or to your job, or you're a first responder getting to your job. And so for the most part, ridership is really down now. And those people that are riding, we expect, for them to be going to a place and staying at home or staying wherever they stay.
Okay, very good. And so let's talk good news. Let's talk some good news. Now, the city, there was a lot of press around private donors in the city. I think now the number is over 3 million. I honestly don't know the number in terms of funds to help people. This is probably about 2 weeks ago. Tell me in terms of what you know as far as distributing that, because part of what your division deals with is, of course, social services and all of that. So have you seen different reallocations for social service funds and all that to help the need that we're seeing with, of course, the rise in unemployment claims and people who are finding themselves in positions they may have never been in before? How are we addressing that from a financial standpoint to address that influx that we're seeing around unemployment because of this?
Well, unemployment is a real issue. Our systems in these various states were not designed to handle, millions of phone calls, unfortunately. And so it may take some time to get through that process. We've requested data for Mecklenburg County, and we still haven't received it from the state. But they are processing those claims. And with the CARES Act, it extended the amount of weeks that a person can receive unemployment benefits. So I believe that that's working. As far as some of the social services funds for food assistance, there was a federal waiver granted to our state where individuals can receive the max amount of food assistance now. And I believe for a family of three is over $500 per month.
Mm-hmm.
And for a single individual is close to $200 per month. And some single individuals were receiving like $20 or $30.
Wow.
It just depends on their eligibility. And some family of three were receiving less than, $150 or so. So we've definitely expanded that benefit. We've made it easier to access Medicaid for the healthcare benefit for those individuals that lost their jobs and lost their access to healthcare. For those families and those disabled individuals, we've made it easier. Individuals can apply online or over the phone, and we're processing those applications fairly fast. We're actually caught up here in Mecklenburg County in processing applications. I know the unemployment system has a backlog, but we don't have a backlog here in Mecklenburg County.
What's the website? I'm sorry, I didn't mean to cut you off, but what's the website if someone finds themselves needing to apply for either?
mecknc.gov.
Okay.
And for and the phone number is 704-336-3000.
Okay. Again, that's 704-336-3000, and that's mecknc.gov if someone finds themselves or someone they know finds themselves in need of assistance, and that they can now apply for much, much more that was available to them before. Now, is this a permanent change, or is this a change just for the time where we are, such a time as this, if you will?
It's just such a time as this.
Okay.
This is, and you have to request federal approval for a waiver to expand it. And so this is temporary.
Okay. All right. So good news. What's the best thing that you've heard in wake of all of this that's going on? Give us some good news. What's going on? What can we be optimistic about in all of this?
Well, good news for me is, having friends that have, having a friend that was on a ventilator for 2 weeks and is off the ventilator and is healthy.
Amen to that.
Having, other friends that were really ill that are now healthy and are able to take care of their children. That's good news to me. The small business loans that are available through the county and will be voted on, should have been voted on by the city tonight, is also good news. And that information is on mecknc.gov for the county. We know that 173 organizations have started to volunteer. And there was a press release earlier today to talk about those organizations who have stepped up and supported this community. We know that CMS has continued to provide school lunches and have provided over 500,000 school lunches since schools have been closed. I mean, that is huge. We know that Elevation Church has given out various kits, sanitation kits for individuals. We know that various other churches have stepped up. We know that our Black pastors have stepped up and really have increased their communication to those seniors that don't get on Facebook or Instagram or YouTube. They just want a phone call and they just want to hear from somebody. And we know that our churches have continued to do that. So there's definitely good news that people are being healed. There's good news of small business loans. There's good news of additional social services. So I think there's some good things. And I think families are talking to one another now because they're getting tired of looking at social media.
Right. You can only do so much Netflix and Disney Plus. I mean, come on.
Right,
How many
right, right,
times y'all gonna watch that Trolls movie? I mean, come on now.
right, right,
Enough already. But
right.
I mean, I think people have to find some joy in all of this. And maybe this is God's way of a giant reset for many of us, but we can't lose sight of the fact that 20,000 people in the US, of more than 20,000 people in the US have lost their lives, and families have been affected. And we now lead the world. We lead the world, and we'll unfortunately be in a position where we'll always lead the world going forward. I think just in the sheer numbers, but it's such an encouraging thing to know that it's just not all about the ticker tape that we're seeing every night, if you're even watching it, of what the numbers are. And because we have to be aware of it, I mean, because we have to take this seriously, but to know that people are recovering, and people are making it through this, and are being blessed, to be able to have a chance to be able to share their story. What other good news? You getting some sleep? A little bit. That's
No,
good news.
I am getting some sleep, and what's good to me is that my family is healthy,
Mhm.
and I'm able to get on shows like yours, Little Cousin's show. Um, Smile and laugh and be healthy. That's good news. But when people just reach out and call me or text me and just check on me. I mean, I think, people, we live in a real giving, caring community and country. And those caring small deeds are really showing. So I'm happy for that.
What would you say, and without any profanity, what would you say to someone who still refuses to accept that we have to do something, and that it's a personal responsibility, but it's also responsibility for the people we come in contact with? And I'll give you an example. I had a conversation today with someone who I thought was pretty intelligent, thought so, but we got
Hmm.
to talking about this, and he said, "Well, that's not my president, and I'm not gonna follow the rules." I said, "What do you mean you're not gonna follow the rules? Like, what do you mean?" Because I was like, okay, don't freak out, Yolanda. Like, maybe this is just, I don't want to misunderstand, but legit was like, I'm not doing any of that. I'm not social distancing. This isn't real. And went as far as to say, and this is what I found disturbing, but also realized that this is a mindset that a lot of people have. Had a family member that passed away from an uncle. But instead of that even being a wake up call, it was like, well, he shouldn't be, literally, it was like, well, he shouldn't have been eating meat. It was that meat that killed him. What? Like, vegetarians
Mhm.
aren't getting this. Like, what is
Yeah,
that?
yeah.
So, what would you say, real talk, to someone, or how would you even broach the subject with your own friends, family members who still have this mindset that this isn't real and that it's not going to affect them, and who cares? Like, what would you say to that person?
Well, when you just said 20,000 people have died, I mean, those are real people, and you have to, really break it down to, the risk that they're taking that potentially could take somebody else's life. And it's not just about them, because they could be asymptomatic. And, if you care about other people, that you will actually take some personal responsibility and really adhere to the direction that we're giving folks. Because, I mean, again, as I said earlier, the CDC person said 80% of this country potentially will have it. We should assume that everybody has it, and just care about somebody else. If you don't care about yourself, care about me,
Mhm.
as your friend. And it's so much information and so many facts that are out there, and the media has just really been pushing social distancing and the risk associated with this. And to see people cry,
Mhm.
if you don't have any compassion there, I would say Atrium has a behavioral health line. Cardinal has a behavioral health line. And we have a mobile crisis center that has a line. And maybe call one of these lines and try to you know see what's going on with that individual.
So last couple of questions, and somebody had submitted this before the show, and I believe Governor Cooper has already addressed this as to why is it that the ABC stores are considered essential in this day and age. I know the answer, but what's the answer?
Well, some of them provide food
Not the
and
ABC store,
beverage.
baby. You tried it though.
You know,
Not that store.
I trust our governor knows what's best for our state.
No,
Well,
that's real talk. And he answered that. It's like, we have to be realistic. I mean, if we close the ABC stores, we're flooding hospitals
yeah,
with people going through alcohol withdrawal. And and I respect that. I mean, you have to understand the lesser of two evils at this point.
yeah.
And you have to figure out what's that risk assessment as far as that's concerned. I mean, we all joked about, you got to have that yak. Why are you trying to get through this?
Yeah.
But no, real talk. I mean, that's very, very important. You mentioned a mobile crisis center, and I think a lot of people don't know that we have that. And I think we're going to have some real, if we can have you back, because I don't, because this is obviously the first of many conversations as we kind of like wade through this. Because one of the things we're going to have to deal with later are people who are struggling with depression, who've never had it before. People are struggling with anxiety who've never had it before, because we're in a whole new world. So, what do you say to someone, or what options are out there that they may be able to talk to someone, or perhaps seek an evaluation if they're feeling, high levels of anxiety, or maybe dealing with or struggling with depression? What options are out there for them here in Mecklenburg County?
Well, I think we have a lot of options. Hopefully people are taking advantage of them. Cardinal has a 24-hour crisis hotline, and that number is 800-939-5911. Atrium has a behavioral health helpline, and that number is 704-444-2400. And then we have a mobile crisis team, and that number is 704-566-3410. And again, I'll share these numbers with you.
Okay.
So there's definitely resources available. You're definitely concerned about those resources being stretched, because this is causing a lot of trauma to the brain when you can't do something that you were able to do before. It really does stress people out.
Mm-hmm.
If a person's love language was physical touch, and you can't reach out and touch someone, that's a real problem, and it can cause some real stress. So we recognize that. And for me, I have staff that are still in the community doing work in our YFS area and our services for adults area, and they're still going out taking calls of child abuse and neglect, or adult abuse and neglect, and they're going into homes and investigating situations. And domestic violence is another area that we are very concerned about. And specifically, one of the saddest stories that I've ever experienced. One of our colleagues in the county manager's office was murdered last week
Wow.
by her husband, who she had a protection order out, and he came and murdered her and her child, their child,
Oh
and
my
then
gosh.
killed himself. So, trauma to the brain and the stress associated with, this and other issues is real. And we want people to get the help that they need. So I can go on and on and on.
And that's why I love you. Because it's just so important to get this information out here. I'm going to repeat for those of you that just tuned in or tuning in later, the options as far as if you're dealing with a potential mental health issue or someone that and there's no shame in making that call, because for a lot of people, you may be experiencing real depression for the first time or real anxiety for the first time, because this is something that's new for all of us. It's funny because you said like your love language, like if your love language is physical touch, mine is quality time. I'm about to lose it.
Right.
There's only but so many FaceTime calls you can make and
Right.
virtual happy hours. Oh God. Oh, and I can't get on a plane, child. Anyway, but it's hard. And in all transparency, for me, I know there was at least a few days where I just did not understand what I was feeling. And it just knocked me off my socks, because it was just like, what is this? And I don't know if that's what it was. I had to, go into prayer and a lot of meditation, a lot more prayer, and just had to kind of find myself again. But there is no shame in admitting and seeking help if you feel like you need help. So there's the Mecklenburg County, is it Mecklenburg County Mobile Crisis Center? I want to make sure I say it correctly.
Yeah.
Okay. So that number is 704-566-3410. Cardinal has a 24-hour crisis center. That's 1-800-939-5911. And Atrium Behavioral Health, their number is 704-444-2400. I'll be posting this in the comments, and I'm going to do a longer, quick blog post as well. So for those of you watching, you can share that information. But like I said, despite all of that, despite what we're dealing with in Mecklenburg County, in the bigger picture, with all of the changes that people are feeling and dealing with, the beautiful part, in some respects, because you have to be able to see the positive in this, is that, in terms of people having time together, people finding unique ways to still connect when you don't have the physical ability to connect. What were people finding and using social media in a way that's positive to connect, and just people having to reinvent themselves in a way that's positive as well. And the fact of the matter is, as bad as the numbers are, people are surviving. And we have to celebrate that, and the goodness of his mercy in terms of people being able to get their lives back. But we also can't be dismissive of people who have lost their lives and how that has a greater impact on their families. So, we hug your friends from a distance, hug your family from a distance. Make sure you're wearing your mask. One other quick question: a person doesn't have a actual medical mask, they can make their own mask.
That's
and there's
correct.
plenty of YouTube examples out there. People are selling masks out there. So there's plenty of ways that you can get them if you can't get a medical one. Please sanitize it properly. No, you can't put a cloth mask in the microwave. You're going to burn your fabric, and then you're going to be breathing all those chemicals. Don't do that. Hot soap
Right.
and water and detergent, like wash it. Same with medical masks. You can't be reusing them all the time. Anything else, little tidbits that and the whole gloves thing. My goodness. Don't put the gloves and then touch everything and then be trifling and leave your gloves on the ground, or end up touching your face anyway. You just spreading it all over the place. Am I missing something? Anything else we need to not be doing?
That was good.
Okay. All of those good things. So for those of you who tuned in, your mama was here. Your sister was here. Looks like your brother-in-law was here. Elizabeth's here. She posted the Hope for NC helpline as well, which is 855-587-3463. Thank you for that. We're going to post that. I'm going to post Trinavia's study that she did. Elizabeth also indicated the Michael Jordan Clinic on 9149 Freedom Drive is opening as an assessment center starting on Wednesday. Wednesday during the week. I'm not sure if I'm reading that right, from 8 to 5. But for those of you who have tuned in, thank you, of course. Now, obviously, no, you can't reach out to him directly. Leave him alone. He's trying to get a nap every now and then. But no, in all seriousness, I truly want to thank you for all of your hard work, because since you've been here, you really have made a tremendous impact in ways that you really, truly do not know. And the fact that having probably one of the most people-centered areas that you supervise, in a way, it requires a level of understanding and empathy and organization and all of those things, but just being able to deal with people, and you do that so well. And that's not me just saying that from Trotman to Trotman, or that's your cousin. I mean that sincerely, because I hear that all the time from people who ask me if we're related or ask me if I know you, because this type of work that you do specifically impacts the lives of everyday people, and you don't take that lightly. And so I truly appreciate you for that. So thank you for the wonderful wealth of information. If you haven't done so already, shameless plug, make sure that you are liking, following, and subscribing to everything, all social media at The Convo Pod Show. And this actually showed up on the YouTube channel tonight. Thank goodness. So all of our future live shows will also be showing up on YouTube if you're not connected to us through the Facebook page. So definitely you got to come back. And next time maybe we can have a drink and talk about other stuff. But it has been a real joy. Seriously. Thank you so much for joining us tonight and giving us so much wonderful information and just being real with us, because we don't oftentimes get the opportunity to see people who have the type of work schedule and responsibilities that you do. Just be yourself and to be able to have an open and honest conversation. So I appreciate you. Truly.
Well, I appreciate you too.
All right, so virtual hugs and stuff. I miss you. All right, y'all. So tune in a little bit. I'm going to post all this information as far as the numbers, as far as the mobile testing, as far as where you can gather more information. This has been absolutely fantastic. Thank you again for joining us on the conversation. Like I told y'all, nobody gets to call him Big Cuz other than me. I said that at the beginning, and I mean that. Don't make me come looking for you. Join us next time on the conversation again. Follow us on all things social media at The Convo Pod Show. Good night, y'all.
Good night.